You know that nagging pain you can get in your forearm? A lot of us, and yeah, even our doctors sometimes, immediately jump to one conclusion. Oh, it's gotta be carpal tunnel. But what if I told you the real troublemaker is actually hiding in plain sight, just a little bit higher up your arm? Well, today we're putting on our detective hats. We're gonna investigate a really common but super misunderstood condition, the mystery of Pronator Teres syndrome.
Okay, so let's just get right to it. Is every single ache and pain in your forearm automatically carpal tunnel syndrome? The answer? Absolutely not. Not even close. And here's why that matters. Mixing these two up can mean you're stuck for weeks, maybe even months, with treatments that just don't work and a whole lot of frustration. So yeah, let's get to the bottom of this.
So, what does this elusive pain actually feel like? Well, it's not usually that sharp, stabbing pain you might get in your wrist. No, this is different. It's more of a vague, deep, nagging ache right there in your upper forearm. And it really flares up when you do anything that involves forcefully twisting your arm. Like trying to use a screwdriver, wrestling with a stubborn doorknob, or even just lugging a heavy grocery bag. Now, you're probably thinking, okay, this must be some super rare, obscure thing. But it's really not. I mean, yeah, carpal tunnel gets all the headlines, but pronator Terry's syndrome is way more common than you'd think. It's responsible for almost 10% of all median nerve problems. Think about that. That's basically 1 out of every 10 cases. That's a ton of people dealing with this exact issue, which is exactly why figuring out how to spot it is so critical.
All right, to crack this case, we have to do what any good detective would do. We need to survey the crime scene. In this case, that's the anatomy of your forearm. The whole mystery really boils down to one key player, a nerve, and a very, very tight spot it has to squeeze through.
So let me introduce you to our victim in this story, the median nerve. And this nerve is a big deal. Think of it like a major information highway that starts up in your neck and travels all the way down to your fingertips. It's in charge of so much, a lot of the feeling in your hand, and it controls the muscles you need to, grip things and make a fist. And here, this is the exact spot where things can go sideways. See, as that median nerve makes its way down your forearm, it has to pass right between the two sections of a muscle called the pronator teres. It's like a highway having to go through a narrow mountain pass. Now, if that muscle gets tight or swollen or just overworked, it starts to squeeze that nerve. And that, right there, is where all the trouble starts.
Okay, before we dig deeper into our mystery, we have to talk about the usual suspect, right? Carpal tunnel syndrome. It's the one everyone's heard of. It involves the same nerve, the median nerve, but the pinch, the entrapment, happens way lower down, at your wrist. There's a little passageway there called the carpal tunnel. And honestly, because it's just so incredibly common, it kind of steals the spotlight from everything else. And this is the classic signature, the telltale sign of carpal tunnel. People will almost always tell you the same story. I wake up in the middle of the night, my hand is totally numb or tingling, and I have to shake it out to get the feeling back. That one specific symptom is a massive clue for doctors. And you know what? When that symptom isn't there, that's just as important. So how do you tell the difference? How do doctors actually play detective here? Well, it really comes down to two things. Carefully listening for those key clues in what the patient is describing, and then using some specific physical tests to pinpoint the real location of the problem. So let's do it. Let's open up the case file and put the evidence side by side. Okay, this chart really lays it all out. Let's break it down. First up, where's the pain? For pronator Terry syndrome, let's call it PTS, the pain is in your upper forearm. For carpal tunnel, or CTS, it's all about the wrist and hand. Simple enough. Second, what about those night symptoms we just talked about? That's a classic sign of CTS, but you almost never see it with PTS. Now this third one. This is a really cool clue. Numbness in your palm. See, the little nerve branch that gives you feeling in your palm actually splits off before it gets to the carpal tunnel. So if your palm is numb, the problem has to be higher up in your arm, which points the finger straight at PTS. And finally, what makes it worse? For PTS, it's that repetitive forearm twisting. For CTS, it's more about bending your wrist over and over. So the whole diagnostic investigation follows this really logical path. First, it always starts with your story. A doctor is listening for all those little differences we just went over. Next, they'll move on to some physical tests to basically try and recreate the scene of the crime to see if they can trigger that nerve compression. And the big one, the smoking gun for PTS, is called the pronator compression test. Basically, a doctor will have you try to turn your palm face down while they resist you. And if doing that one thing brings on that familiar pain or tingling, Well, that's a pretty surefire sign that the pronator teres muscle is our culprit. Okay, so once the mystery is solved and you have the right diagnosis, everything gets so much clearer. And here's the really good news. For most people, the huge majority of people with pronator teres syndrome, you can get relief without needing any kind of surgery or invasive procedures.
The first step in the treatment plan is pretty straightforward. It's all about calming things down. That means, number one, rest. You've got to modify or stop doing the things that are causing the problem. A splint can also be a huge help, but, and this is a key difference, you wear it on your elbow, not your wrist. The whole point is to keep that pronator muscle nice and relaxed. Then you'll get into specific stretches for that muscle and these cool things called nerve gliding exercises, which literally help the median nerve slide back and forth more freely. And sometimes a corticosteroid shot right at the spot of the pinch can work wonders to knock down that inflammation.
So what if all that stuff doesn't do the trick? Well, if you've really given it a good go for, say, 3 to 6 months, and you're just not getting better, that's when surgery might come into the picture. It's a procedure called a surgical decompression, and it's exactly what it sounds like. A surgeon goes in and carefully releases whatever tight muscle or tissue is squeezing that nerve, just to give it more room to breathe. And that really brings us to the single most important takeaway from all of this. It's so simple but so crucial. You just can't treat a problem effectively if you don't know what's actually causing it. I mean, you could wear a wrist splint 24/7 and do carpal tunnel exercises all day long, but it won't do a thing if the real pinch is happening up in your forearm. Getting the diagnosis right isn't just a minor detail, it is everything. It's the foundation that your entire recovery is built on.
Which kind of leaves us with a bigger thought to chew on. When you go this deep on just one condition, it really makes you think, doesn't it? It makes you wonder what other simple aches and pains that we all deal with might actually have a more complicated or just misunderstood story behind them. What else out there deserves a second look?